Hello class, my topic is on the prevalence of elder abuse in institutional settings. Over the years, we've heard a lot about elder abuse and just how it is believed to be a growing problem throughout the United States. This is very true. In fact, each year they say that thousands of individuals aged 65 and older are becoming victims of this senseless act. The National Center on Elder Abuse had conducted a study just to look into this and see just how big of a problem it was, and they had determined that many of these cases go unreported. In fact, only about 1 out of every 14 cases of elder abuse is reported to the proper authorities. This study had also found that for every one case that had been known to the proper authorities, there was approximately 24 cases that had remained unknown. Elder abuse is believed to be such a big problem throughout the United States due to the amount of elderly people that we have within our nation. And a lot of people think that this is due to the baby boomer generation and the increase of elderly people being placed into these nursing home care facilities now to be cared for. If the elderly population should continue to grow the way that they're expecting, which they're saying should be anywhere between 20 and 31% within the next 20 years, then we can also expect for the prevalence of abuse to continue to rise as well, because those individuals will continue to be placed in long-term care facilities or nursing homes to be provided with care. One study had found that nursing homes throughout the United States actually have the highest rate for all forms of abuse, and the amount of that abuse tends to double when a person is transitioned from in-home care to a nursing home or a long-term care facility. Another study conducted by the National Center on Elder Abuse had found that when interviewing 2,000 nursing home residents in the year of 2000, about 44% of them had admitted to being abused while receiving care within the nursing home, and about 95% of them had reported or had admitted to witnessing other residents being neglected while receiving care inside of that same institution. There are several types of elder abuse, and it's so important to be able to recognize the types of abuse that are out there so that we are able to help combat against this problem in the future. The most common forms of elder abuse are physical, emotional, sexual, financial, and neglect. One form of abuse that we hear a lot about in institutional settings is physical abuse, and this occurs when a caregiver intentionally inflicts physical pain, impairment, or bodily injury onto an elderly person. Most typically, a caregiver will start by hitting, slapping, punching, or even restraining the elderly individual. Clearly, as a person ages, they become more frail, which leads to more instances of broken bones, welts, bruises, and lacerations. The California Advocates for Nursing Home Abuse Reform had found that 1 out of every 3 nursing homes within our country were cited for abuse between the years of 1999 and 2001. Many of the citations that were given were for bruising, lacerations, broken bones, and other physical injuries that had resulted due to the abuse that these individuals had encountered by nursing home staff members. Another form of abuse that we hear a lot about in institutional settings is emotional or psychological abuse, and this occurs when a caregiver inflicts harm to an elderly person by using both verbal and nonverbal behavior. A caregiver that abuses a person this way typically makes frequent threats, they insult the elderly person, or they love to humiliate them. A few examples of this were found in some studies that I had used for my literature review, and they explained that one resident had asked the nurse's aide for her medication. The nurse's aide had told that elderly individual that she hoped she choked on it. Other residents had reported getting yelled at for having their call light on. The aide would then come into the room and tell them that she could not be bothered with them. Clearly, when your requests are being ignored, you would begin to start feeling isolated and unworthy. Maybe you refuse to participate in life. Perhaps you begin suffering from depression. Many of these individuals will even demonstrate an increased level of fear toward their caregivers. Sexual abuse is another common form of abuse that we hear a lot about in institutional settings. This happens to be non-consensual in nature, and occurs when a nursing home staff member forces an elderly individual to undress, engage in sexual activity, watch pornography, or perhaps they even make them watch sexual acts be carried out in front of them. There is no doubt that this form of abuse is very humiliating for these individuals, as they usually end up suffering from bleeding of the genitals, bruising of the genital or breast areas, and it's not uncommon for them to be exposed to sexually transmitted diseases or infections. We also hear a lot about financial abuse, and this occurs when a caregiver misuses an elderly person's resources. Typically, in an institutional type setting, it's not uncommon for healthcare professionals to gain access to the individual's room. They know where their wallets, their purses, and other belongings are. Perhaps they even notice that there's some money laying on the bedside table, and when that individual leaves the room, they are able to come back and gain access to those items. They may even try to convince the elderly person to change their will. Maybe they attempt to be listed as their power of attorney. And all of these are just tactics to be able to obtain that person's assets. It's recommended that families and elderly individuals take some steps to help from being financially abused. They can do this by making sure that all checks have been accounted for. They should also make sure that all of the signatures on the checks belong to the elderly individual, and they should pay close attention to all money that is coming out of bank or savings accounts. Neglect is also a very common form of abuse that we hear about in institutional settings, and this occurs when the caregivers fail to meet the basic needs of the elderly residents. A lot of times we hear about nursing homes failing to provide individuals with the proper nutrition, help with their personal hygiene, medical care, preventative health care, as well as social interaction that they need in order to thrive. In one case, a resident had requested a bedpan, but the nurse's aide failed to provide it for her. That same nurse's aide later placed the call bell out of reach so that the resident could not use it. This nurse's aide's negligence forced the elderly individual to urinate on themselves and wait until the morning to get cleaned up. What is so sad about situations like this is that those that have to place their loved ones in nursing homes and long-term care facilities believe that their loved ones are being cared for and treated with the utmost respect. It is absolutely imperative for healthcare professionals to know how to recognize the risks and be able to understand why it is that this elderly population is at such a risk of being abused and neglected. There are many risk factors associated with elder abuse. One of the most common risk factors is that a lot of these elderly individuals that are placed in long-term care facilities and nursing homes are isolated. Also, individuals that suffer from mental impairments are also at a higher risk of abuse, because these individuals, both the ones with mental impairments and those that are isolated, are not able to flee from the abusive environments, nor do they have anyone that they can count on to report these acts to. The second risk factor is that many of these individuals have very few visitors, and those that do are more likely to experience abuse because they do not have anyone that comes to regularly check on them or monitor their level of care. The third risk factor is that a person with a higher level of dependence is also at a higher risk of abuse. And this is generally just because these individuals require more care and more interaction with the staff members. It's said that abuse tends to happen more frequently when the worker feels as though they're being inconvenienced by a person's request. Therefore, a person that has a higher level of dependence requires these individuals to be in the room more frequently, needs their assistance to do a lot of other things that maybe some of the other residents are able to do on their own. This only increases the person's risk for being abused or neglected. The last biggest risk factor is that healthcare workers often lack the knowledge and the skills that are needed in order to properly care for the individuals. Many people wonder how we can go about detecting elder abuse. What I have learned throughout all of the research that I have conducted is that detecting elder abuse is actually a lot more challenging than any of us could even imagine. But there are a lot of steps that we could take. Institutions should start documenting the normal bruising patterns of every elderly resident. And the reason for doing this is because as a person gets older, they're more susceptible to bruises, broken bones, lacerations, things of that nature. And even if the person was getting the best care possible, it is possible for these things to still occur. Documenting those normal patterns would allow us to identify whether or not the bruises are consistent with the person's normal bruising pattern, or if it's possible that those bruises have been inflicted by someone else. Another important step to take in order to detect this type of abuse is to listen to the elderly residents and their families. A lot of times, problems are overlooked because of the simple fact that many of the healthcare professionals believe that the residents maybe have a mental impairment or something that hinders their ability to be truthful about what is really occurring. Oftentimes, emotional abuse is overlooked because a healthcare professional will think that maybe the person has dementia, even if that's not the case. We must be willing to listen to every one of the elderly person's concerns, regardless if we believe they are factual or not. It's also very important to pay close attention to a person's personal hygiene, their weight, their dental health, and to make note of any sores found on the body. Doing this can help us to determine whether or not maybe the person is being abused or neglected. We should also keep in mind that a lot of elderly residents are very afraid to speak up about the abuse that they have endured because they fear retaliation from the perpetrator. A lot of times they're humiliated by what had occurred to them, or maybe they lack the mental capacity to understand that they're even being victimized. Screening is said to be one of the most effective measures in order to stop elder abuse, because this really helps us to be able to identify and be able to report these instances. Basically what this is they recommend that all individuals aged 65 and older be screened by their physicians to rule out any possible abuse or neglect. If the physician has reason to believe that any abuse or neglect has happened, then they must conduct a full body scan to look for any bruises, lacerations, untreated bed sores, damage to the genitalia, or any other bodily injuries. Upon completion of that full body examination, they should also conduct some x-rays to rule out damage to the bones, and they should do a complete blood screen to rule out malnutrition and dehydration. These types of screening methods can be used to help determine if abuse or neglect has taken place. There are plenty of steps that elderly alone can take to protect themselves against elder abuse. These steps include avoid isolation, request frequent visitors, maintain a social life, keep finances in a safe place where they are unable to be obtained by anyone but you, keep all scheduled doctor's appointments, and refuse to sign any papers without having an attorney present. There's also a variety of steps that families can take to help ensure that their loved one is not a victim of abuse or neglect within the nursing home. What they can do is assess all nursing homes before making a decision to place their loved one there. They should also strive to conduct interviews with administrators and staff members, and they should feel free to conduct checks to determine if the institution has been adhering to the regulatory codes. There are also some steps that the institutions alone can take to help prevent abuse. Some things that they can do would be to offer abuse-related training and support to all of their staff members. They should also educate all of their staff members on how to properly recognize and report all instances of abuse. Not to mention, nursing homes and long-term care facilities should implement programs that will allow staff members to address their stress levels. Avoiding burnout can significantly help to reduce the amount of elder abuse that is currently occurring in nursing home settings. Public awareness and education are also two other preventative strategies that are commonly used to help combat against elder abuse. The reason that they're so effective is that they help to change the attitudes and beliefs that people have in regard to elder abuse. They help to promote an understanding of the issue. They allow the members of our society to see the need for change. They provide information to the general public as well as healthcare professionals. They allow others to gain a better understanding of the types of abuse that are prevalent among this particular population. They help others to effectively recognize the signs and symptoms associated with elder abuse. They teach healthcare professionals how to provide the best care possible for elderly individuals, and they help teach the general public as well as healthcare professionals how to report all instances of suspected abuse. At the conclusion of this presentation, I hope that you're able to walk away with a much better understanding of how big of an issue elder abuse in institutional settings is throughout the United States. In order for us to effectively end this type of abuse, we have to begin educating nursing home staff members, physicians, family and friends of the residents, as well as the overall general public on ways to recognize the risks and warning signs associated with this type of abuse. We should also educate others on the topic of elder abuse. This not only helps to raise awareness, but it can also help to reduce the number of cases that occur each year. We should also help to ensure that all healthcare professionals are aware of the ramifications that are associated with failing to report suspected abuse. Because currently, despite all of the mandatory reporting laws, many of these cases of abuse continue to go unreported. And the reason for that is because detection is so difficult, and many of these healthcare professionals lack the knowledge and skills that is needed in order to properly identify what is going on with these residents. We must also strive to educate the general public so that they can effectively identify abuse and neglect when they are visiting their friends and family or volunteering their time in institutional settings. Being able to recognize the warning signs could be the difference between life and death.